Good evening, I'm Neil Kirksall. Adrian and Andrew are away tonight. The Moderna COVID-19 vaccine is approved and on its way.
The first doses will arrive in the coming days.
How it's different from the Pfizer-BioNTech shot and the profound impact it could have on remote communities. When can you get your shot? Will you have a say in which vaccine you get? Well, we have two doctors here ready to answer all of your questions. A horrific scene inside a long-term care home. How is this happening months after all of the promises of never again? And a newcomer to Canada gives back.
I need a family. I've been away from my family for almost 10 years, and I feel everybody here is my family, so I treat them like my family.
This is The National. If vaccines are a light at the end of this long, dark COVID tunnel, well, today that light got a bit brighter. The Moderna vaccine is coming to Canada.
This authorization is a critical step in ensuring a COVID-19 vaccine is available to all Canadians in all parts of the country.
This second vaccine can reach areas the first one can't. It can go into more remote and northern communities, some of which have been hit hard by this pandemic. 168,000 doses are expected to arrive in this country in just a matter of days. Canada has a deal to get 40 million doses of the Moderna vaccine. That is enough for 20 million people to be vaccinated. Olivia Stefanovich with where it's being eagerly awaited and where the roadblocks could be.
We know that this pandemic doesn't start to end until we have vaccination of millions and millions of people.
The approval of the Moderna COVID-19 vaccine brings that goal one step closer.
This is excellent news. We were anticipating the approvals now for a couple of weeks, and it is going to be a key to COVID response in Inuit Nunangat.
Northern and rural communities were left out when the first vaccine from Pfizer-BioNTech was approved, since they lack freezers needed to store the doses in extreme cold temperatures. Moderna, by contrast, can be transported more easily, making it a realistic option for remote areas.
The underlying risk that we have for respiratory illness is much greater because of the lack of infrastructure, whether it be healthcare infrastructure or housing.
But getting the vaccine into hard-to-reach places is one thing. Injecting it into arms, another. Many rural communities don't have permanent physicians, let alone hospitals. The Canadian Red Cross and the military may be called in to lend a hand, but there are concerns some Indigenous people may resist rolling up their sleeves.
Because we have been used in history for horrible tests. So there's also a population that believes they don't want to be used as guinea pigs. So we have our own work to do. A huge education component will be coming.
Within the next 48 hours, doses should be in Canada.
Moderna says 168,000 doses are expected to arrive by Christmas Day. The territories are expected to get their first shots by next Monday, with 40 million doses expected by the end of 2021. Even still, communities are being encouraged to stay vigilant.
It doesn't give us a green light to relax our measures that we've been having in our communities for some time now.
So, Olivia, what do we know about the rollout plan specifically in the north?
Well, the Premier of the Northwest Territories, Carolyn Cochrane, says her government wants to prioritize residents of long-term care homes and frontline health workers, followed by small Indigenous communities. Moderna is a key that's unlocking huge parts of this country, Neil, to vaccinations. And it's expected that up to 75% of adults living in the territories can get their shots before the end of March.
Thanks so much for this, Olivia.
Thanks for having me.
That's Olivia Stefanovich in Ottawa for us tonight. Now, as you heard Olivia mention, the Moderna vaccine will be easier to transport than its Pfizer-BioNTech counterpart. But there are other distinctions, including who the treatment was tested on. Vicodopia has a look now at what is different and what the two shots share.
Moderna and Pfizer-BioNTech are part of a new generation of vaccines. Both use messenger RNA technology to trick the immune system by creating copies of the coronavirus spikes, triggering antibodies that protect against the real virus. But there are differences. Moderna requires 2 shots 4 weeks apart, while Pfizer's second shot is sooner. Pfizer is harder to transport. It needs ultra-cold storage. Moderna needs less extreme cold. There are also differences in who the vaccine was tested on. Moderna used Americans with a small number of volunteers of different ethnicities, while Pfizer's trial was in a diverse range of countries, which could be important.
Some of the key molecules in our immune system, especially the ones that sort of teach T cells to recognize pathogens, differ between different ethnic groups.
Then there's the question of who can get vaccinated. Moderna used healthy adults for its trial, 18 and up, while Pfizer also included 16 and 17-year-olds.
So to see more data in pediatrics, in pregnancy, in immunocompromised population, we do need to have data in the pediatric age group, and I suspect that at some point we will need to vaccinate the children. Otherwise, we have this gap in our immunity.
Researchers can't say if vaccinated people can still spread the virus, though there is some early evidence Moderna's might prevent that. It's also not clear how long either vaccine protects people.
We don't have enough data to know what protection will look like in a year's time from now. As that data comes in, that's one of the things that we'll be keeping a close eye on, because otherwise we'll be in continuous cycles of vaccinations.
There is optimism both vaccines will be effective against the emerging UK variant of the virus, but as with so much of this pandemic, that answer will come in time. Vic Adopia, CBC News, Toronto.
There are a couple of other vaccine notes to tell you about tonight. The Prime Minister also announced 250,000 more doses of the Pfizer-BioNTech vaccine are going to be coming to this country next month. That is about 10,000 more than have already been distributed in Canada. As for the other vaccines Health Canada is reviewing, the government says it's waiting for more data from both AstraZeneca and Johnson & Johnson before it can make its decisions on those. In Ontario, it is the 9th straight day where case numbers have grown by more than 2,100. In fact, 2,408 is the second highest daily surge on record. At vulnerable long-term care homes, more than 1,000 residents are infected and nearly as many staff. One home in Toronto offers a disturbing picture of what those numbers really mean. 145 people living in that facility have COVID-19, 26 have died. A doctor says patients were dehydrated and lacking basic care. Talia Ricci speaks to a woman anxious to get her grandmother out.
I feel like we had to take matters into our own hands to find out what's going on there.
Jessica Wong says her family is removing her grandmother from Tender Care Living Center.
It's completely out of control. It's in crisis mode. But whatever it takes, there are lives there that still needs to be saved.
One physician called in to help this past weekend went nights without sleep and tweeted her despair. What I witnessed yesterday is needing words I don't have. My brain can't rest, and I think I'm in shock.
I had one nurse with me and 2 PSWs on Sunday for the wing that I was taking care of, and that's nowhere near enough, even without people being sick.
We know that 40 plus or 50 plus workers are sick at Tender Care are in isolation. But how many people are still working there is a myth.
Ontario's long-term care ministry told CBC News it has completed an inspection of the home and is determining what actions to take next, and that a report will be made available on the public website once it's shared with the home. A Tender Care spokesperson confirmed it's finalizing an agreement to have a major hospital help manage the home.
Everyone who I saw there on Sunday was working incredibly hard, nonstop. I think their assistant director of care, I don't even know if she was going home. I think she, it's quite likely she was practically sleeping there.
Wong says her grandma is a fighter. She held part of her wedding celebration at the care home just so her grandma could take part. Now she only wants to bring her home.
We are just waiting on her next test results. As soon as we find out, hopefully she's still negative, we can take her out that same day.
In a newsletter to families, Tender Care says that it's monitoring residents for symptoms twice a day, including taking their temperature and isolating those who show symptoms. They're also screening staff and say there are extensive cleaning protocols. Talia Ricci, CBC News, Toronto.
Some help did arrive today to help keep care homes safe.
The Red Cross has done outstanding work over the last year to keep people safe. That's why today I can announce that we're investing an additional $70 million to support their work.
In October, Red Cross teams were dispatched to 7 long-term care homes. The money the province announced today, the federal government announced today, is going to make sure help gets to 20 more care and retirement facilities. So why is Ontario still in such dire need? While hard-hit Quebec has significantly improved safety in its care homes. Sarah Levitt has a look at that tonight.
Frustrated and disheartened.
Joshua Matchett says the news from Tender Care Living Centre isn't surprising, and he worries for families dealing with the stress. Matchett's father died in April at his long-term care facility in Georgetown, Ontario. Residents are supposed to be checked hourly, but his body was only discovered 6 hours later. An inspector's report concluded the home, quote, failed to protect Travin Matchett from neglect by staff.
It seems that, elderly citizens are no longer a productive part of society, so we can just put them under a rug.
A sentiment echoed by those in the field.
We're going to have catastrophe and carnage within the second wave of COVID-19 in long-term care homes.
This summer, the Commission into Ontario's long-term care facilities heard brutal testimony from residents and healthcare workers about shortages of staff, proper protective equipment, and appropriate oversight, problems which persist to this day.
We should not be having homes where you're having dozens of deaths inside a long-term care home this far into the pandemic. It's unacceptable and it's unforgivable.
They certainly could have rapidly started to recruit and train people to work in long-term care. They could have.
This sociologist points to Quebec, where a recruitment campaign for orderlies was launched in May. Almost 7,000 additional orderlies are now working in homes across the province. But Ontario's recruitment efforts seem stalled. Now there are calls for the Army to step in.
They need to be there as long as we see incidences of neglect and rapidly rising infection and death rates.
But the Army needs to be invited.
Deployments of the Canadian Armed Forces or of the Red Cross is always done at the request of the provinces in question.
Ontario's Solicitor General confirms no request for the Army has been made, at least for now. Sarah Levitt, CBC News, Toronto.
Well, millions of masks sent to thousands of daycares in Quebec are going to need to be replaced. Officials say the masks failed a critical safety check. Staff have been told to stop using them. We're talking about 31 million masks distributed since May. The daycares are getting new shipments now of better masks. There's new COVID modeling in British Columbia as well. The curve there is beginning to bend. Officials there reported 518 more cases today. That is more than yesterday, but here's a look at the bigger picture. The 7-day moving average. You can see the pattern, how it peaks in November and then starts to decrease slowly in response to restrictive measures, which, as Briar Stewart tells us, are being enforced.
This Christmas, it's about COVID crowd control. At the Gourmet Food Warehouse, the line stretches down the block. The store stepped up its precautions at the start of the holiday rush by adding arrows and extra plexiglass.
When everything kind of really tightened up and the restrictions were made more serious for everyone, we definitely took that to heart and we're trying our best to make everyone feel comfortable.
Health officials came by to approve the plan. Dr. Bonnie Henry's watchful eye is even down one of the aisles. Her image is on a best-selling bottle of barbecue sauce. Well, officials say most are following the rules, some aren't, including a couple of churches that are still running in-person services.
There is always, a few that try and skirt the rules, and as we've seen, there are fines that will be levied.
Around 400 fines have been issued since August. In BC, indoor and outdoor gatherings are banned. If someone wants to report a possible violation, officials are telling them to pick up the phone. Just don't call 911.
For the first 3 weeks of December, right up until December 21st, we've seen more than 500 calls come into our call center. People worried about people having house parties or not abiding by the restrictions.
Police departments say call them directly.
Hello, how are you today?
In Surrey, police are checking in on businesses and responding to reports about health order violations. Over the weekend, it had a dozen calls.
Our officers follow up on each and every one of those complaints, and wherever appropriate, they are issuing violation tickets.
On Sunday, they issued a $2,300 fine to someone who hosted a baby shower with multiple guests. Officials are hoping the public heeds the health orders over the holidays and say, don't think you won't get a fine just because it's Christmas. Briar Stewart, CBC News, Vancouver.
Canada's ban on passenger flights from the United Kingdom is being extended for another 2 weeks, so until January 6th. The goal is to try to keep out a new variant of coronavirus that is spreading in England. That variant has not yet been detected here. Britain is suspending some flights of its own after a new discovery.
We've detected 2 cases of another new variant of coronavirus here in the UK.
Yet another mutation, this one appearing to come from South Africa. It may even be more transmissible. In response, the UK says it is halting flights from that country and telling anyone who's been there in the last 2 weeks and their close contacts to self-isolate. Well, in the midst of this pandemic, there is another crisis, opioid overdose deaths. While the situation is most dire in British Columbia, it is taking a toll on other provinces as well. More than 1,500 people in BC have died after an overdose so far this year. Last year, that number was 980. Then there are the overdose emergency calls. In Regina, there were 86 of those calls last year. This year, nearly 1,100. Bonnie Allen has that story tonight.
After 15 years of doing drugs, Angela Stephan has moved into a women's shelter and, for 2 months, stayed clean. The Regina woman became alarmed after losing 24 friends and acquaintances to drug overdoses.
It's scary when you wake up. You don't know who's going to be gone from overdose.
This year, emergency services have responded to more than 12 times as many overdose calls.
That doesn't include those that go unreported. So we know, sadly, that number is probably double that.
I would say that it's nothing short of a medical crisis.
Dr. Alex Wong has lost 15 patients to overdose deaths since the pandemic started. He says there's limited access to doctor's appointments and safe prescriptions, turning people to street drugs, including fentanyl. The potent drug is now fairly easy to find in Saskatchewan. In some cases, there have also been bad batches of drugs. Plus, Dr. Wong points to isolation and other social issues exacerbated by the pandemic.
The system is already so strained managing COVID that we haven't necessarily put the same amount of time and attention as we otherwise would in a normal year towards addressing some of what we're seeing in terms of overdoses.
The province has pledged more money for treatment beds. Katrina Long's 54-year-old mother, Josephine Isaac, died from a fentanyl overdose in June after getting an influx of cash from the federal CERB program.
She ended up getting an extra $6,000 that basically went to drugs, and within the 3 months of receiving it, she had passed.
I do a lot of praying.
So much loss could be what saves Angela Stephan's life.
I didn't want to die. You know, the next time I used, I could be dead. And I'm not ready to die yet.
Bonnie Allen, CBC News, Regina.
Outrage and criticism after the U.S. president pardons 4 American security contractors convicted of murder and manslaughter during the Iraq War.
Once you have a series of pardons that goes out for war crimes, then the rest of the world begins not to trust us.
Up next, reaction to that and a wave of pardons for Trump allies announced late tonight. We answer your questions about the newly approved vaccine.
Will I have a say in deciding which one I want?
Our doctors are standing by. Plus, paying it forward. the refugee who is dedicating himself to helping his community during the pandemic.
I need a family. I've been away from my family for almost 10 years, and I feel everybody here is my family.
We're back in just 2 minutes. Welcome back. In addition to news about the Moderna vaccine, Prime Minister Justin Trudeau made another promise today.
We are working to establish January 8th of every year as the National Day of Remembrance for victims of air disasters. Their memories and their stories will not be forgotten.
January 8th will be the first anniversary of the downing of Ukrainian Airlines Flight 752 in Iran. All 167 people on board were killed. Most of the passengers were traveling to Canada. The Prime Minister also announced the next Chief of Defense Staff, Vice Admiral Art McDonald. He'll be the first naval officer to hold the post in more than 2 decades. And when he takes over from General Jonathan Vance in the new year, he'll have a critical task at hand: the ongoing rollout of COVID-19 vaccines. It was widely expected that Donald Trump would issue controversial pardons before leaving office. Well, tonight he is meeting that expectation. Katie Simpson joins me now from Washington. So, Katie, take us through what's happened tonight.
President Donald Trump is helping out his allies and family. Trump announced full pardons for 26 more people, including Paul Manafort, his former campaign manager, who was found guilty as part of the Mueller investigation, and Roger Stone, his longtime associate, who also faced charges out of that same probe. Charles Kushner is another name that stands out. He's the father of Jared Kushner, Trump's son-in-law and advisor. Charles Kushner was found guilty of illegal campaign contributions and of intimidating his own brother-in-law. Kushner set his brother-in-law up with a prostitute and filmed the encounter to use it as leverage to convince his brother-in-law not to testify against him. He's getting a pardon. It comes as the country reacts to yesterday's round of grants, including clemency for Americans convicted for the massacre of innocent civilians in Iraq. It's one of the darkest moments of the U.S. occupation of Iraq. Security contractors opening fire, unprovoked, on innocent civilians in a crowded Baghdad square, killing 17 people. The youngest victim, 9-year-old Ali Kanani, shot in the head as he sat in the back of his dad's car with his cousins.
They took numerous incoming rounds, and when Ali's 2 little cousins that were sitting next to him, when they screamed that Ali has no hair, I think is so important is the story of the victims.
The guards hired by Blackwater Security were found guilty of a range of offenses, but yesterday, all 4 were granted full pardons by the president, sparking outrage.
People who kill innocent civilians in a theater of war, they get a pardon. They're heroes on Fox, I guess they get a pardon.
The pardons from Donald Trump come after a lobbying campaign by a group of veterans who believe the men are innocent, championed by a Fox News host.
God bless the president for having the courage, which a lot of other presidents wouldn't do, to pardon those men, those veterans who were there defending diplomats, put in an impossible situation.
Trump's pardons suggest he's not only trying to rally his base, but also support his allies. The owner of what was then known as Blackwater Security is also the brother of his education secretary, Betsy DeVos. Fresh fears are now emerging this will hurt the U.S. military's reputation.
Once you have a series of pardons that goes out for war crimes, then the rest of the world begins not to trust us. They believe that we act with impunity in a place like Iraq.
Trump is widely expected to continue on with his pardon spree, helping out more allies and possibly even some family along the way. Neil.
Katie Simpson in Washington. Thanks, Katie.
Thanks.
Well, when we come back, we dig into your questions about the new vaccine.
Once it's arrived in our community, what is the process of ensuring that we do get the vaccine?
The doctors are in next.
Now that Health Canada has approved the Moderna vaccine, we have the green light to start rolling it out across the country.
And Moderna's vaccine will land in Canada, specifically in the territories, on December 28th. So, 2 vaccines, 2 ways to help protect Canadians from COVID-19. By the end of next month, public health officials in this country say we will have 1.2 million doses delivered. Infectious diseases specialists Dr. Zain Chagla and Dr. Lenora Saxinger are here tonight to answer some of your questions. Thank you both for making time for us, as always. Dr. Chagla, I want to start with you because online this morning you called the news of this approval a game changer. Why is that?
Yeah, I mean, I think apples to apples, this is the same as the Pfizer vaccine in terms of its efficacy, what it'll do in terms of reduction of COVID-19 symptomatic disease in those who get inoculated with it. The major difference is that cold chain. And so this vaccine can be stored at -20, which is reasonably the same as many other vaccines that you see at your family doctor's office or at the pharmacy. And it can be even thawed out to stay at 30 days at, a refrigeration temperature, 2 to 8 degrees, which is, incredibly apparent in most healthcare settings and most commercial settings. And so when we're talking about a vaccine that's going to get out into every Canadian, we've had experience with the Pfizer vaccine now for the last week. It's difficult, it's workable, but you have to really put it in urban centers, health sciences centers, and research institutes with the ultra cold fridges. This really means a vaccine that can get out into the communities, get out into remote areas, and get out into the general population.
We heard earlier in the show about some of the differences between Pfizer-BioNTech shot and Moderna, specifically in terms of who they tested in their trials. Pfizer-BioNTech tested people in several countries, South Africa, Turkey, the US, Germany, for example. Moderna tested only Americans. So given that, is one shot better than the other, Dr. Saxinger?
Well, there's no evidence that they're actually very different at all. I mean, they have a very similar mechanism of action. They have very similar efficacy in the trial populations, which are very, very large trials. And so I don't think anyone can really say that either one of them is truly better in terms of how well they work. And they have very similar protocols as well. The main difference is the cold chain and also the timing of the second shot. And aside from that, I think people shouldn't worry about which one they might be up for.
Understanding the differences in how different ethnicities respond, though, to a medication, a vaccine, how important is that, though?
I don't think we've seen any significant difference in terms of immune response to natural infection between populations, and so I don't think we should necessarily worry too much about that. Of course, there will be ongoing monitoring of the efficacy of the vaccines, and also there'll be post-marketing monitoring as they're rolled out as well. So I don't think that seems like a significant concern to me.
Nadine Levictoire sent us a question. She lives in Rockland, Ontario.
How do I know which one is best for me? And will I have a say in deciding which one I want?
Unfortunately, I think, given the scarcity of the vaccine and how precious a resource this is, what's going to dictate likely what people get what vaccine isn't necessarily going to be which one they want. It's going to be which one is available. And really based on the cold chain requirements, where they live, if they have access to a Pfizer center, or is it going to be the Moderna vaccine? We are going to see with some of the data that comes out with this phase 4 post-marketing surveillance, there may be subtle differences that make adjustments to who gets what. But for now, I think it really is going to be what vaccine is available. For the majority, I think Moderna is going to be the one that's available. But if you do live in an urban center where this has been set up, then perhaps the Pfizer vaccine would be offered to you as well. Again, it's just what's there rather than what you want.
One of the other questions we have is from Joss Widjaya, a mother of 11-year-old triplets in Port Moody, British Columbia. She sent us this.
My COVID question is, I heard that they weren't doing any testing for the vaccine on children under the age of 16, so therefore they don't qualify for the vaccination. Is the only way to protect my children and other children is through herd immunity? Thanks.
So we do know Pfizer-BioNTech did test its vaccine on people 16 and older, as I understand it. Moderna, though, tested people who are 18 years of age and older. So Dr. Saxinger, what does it mean for children?
Well, in any group where we do not yet have data, that doesn't mean that it doesn't work, and it doesn't mean that we will not have data. So with children and other groups that we don't have much data on, I expect that we will be learning a lot more over the coming months. And because children are much less at risk of severe disease and outcomes like hospitalization and the like, I think that they would tend to be a little bit later in the rollout anyway. So there is work ongoing right now to define the efficacy in children, and there's studies, happening kind of in real time and as we speak to figure that out. So I don't think that people should worry that children will not be able to get the vaccine. It's just that we are still collecting information as we go.
Well, many of the questions we're getting are about timing, as in when will it be someone's turn to get the shot after this initial set of immunizations for those who need it most. Denise Williams wrote to us about that. She's in Belleville, Ontario.
How do we know when the vaccine has arrived to our community? And also, once it's arrived in our community, what is the process of ensuring that we do get the vaccine?
So I think that because the vaccine is being delivered at the level of a public health unit, it'll be very similar to what people have seen with influenza vaccine campaigns, for example, where they'll be notified by local media, by announcements. And I think that there's a possibility that there could be attempts to really target the groups at highest risk to let them know first. And so if you're in an older age group in congregate living or something like that, you'd probably get a specific notification from public health. But I don't think the details are entirely worked out. And nor should they be yet, because I think that it'll be different depending on where you live.
We appreciate your time. As always, Dr. Saxinger, Dr. Chagla, we will speak again, I'm sure. Have a great Christmas and New Year. And you can send in more questions. You can message us directly on Instagram. Find us at CBC The National. You can send us your questions via email as well, covid@cbc.ca, and you can read all of the answers and information the Ask CBC team is still compiling for you. That is at cbc.ca/ask. Well, still ahead for you on The National, a crazy busy Christmas for Canada Post.
We'll be going gangbusters right until Christmas.
What the online shopping surge means for their bottom line and the future of the post office. But first, forced to postpone her October wedding, Iona Galbraith and her fiancé decided this winter called for a special kind of celebration.
My parents live in Quebec and we live in Nova Scotia. So when I knew that they were coming down for Christmas and they were going to have to do the 14-day quarantine, I figured if we could pull it off, why not get married then?
Cue the 3-week dash to plan the perfect surprise for her unwitting parents.
I knew that my mom would just love it, and her reaction and my dad's reaction was just amazing.
The nuptials have now gone viral. Thousands of strangers are sharing their joy.
I just had my little COVID wedding with the 9 of us, thinking that was it, that, a small, cute little thing, get it done. And people seem to have fallen in love with it.
Canada prepares for the first phase of the vaccine.
The largest immunization in the history of our country.
There's an end in sight. CBC News has the latest updates about the vaccine, how it will be rolled out, and what you need to know to stay safe. CBC News.
They knew that everyone was going to be shopping online. So it frustrates me why they didn't anticipate this demand much sooner.
Basically, I might be ending up giving a few boxes that have a printed picture of the gift in it saying, I owe you this.
So some disappointed online shoppers this season as postal workers deal with a record volume of parcels. The pandemic is pushing consumers online. It's fueling unprecedented demand for home deliveries. That comes with new challenges for Canada Post, but as Ashley Burke explains, it also appears to be opening new doors for the Crown Corporation.
It's the busiest time of the year for Canada Post. And because of the pandemic, the Crown Corporation says the number of parcels is staggering.
As we've moved into peak season, it started earlier and it has continued, it has not relented, and will be going gangbusters right until Christmas.
But still, Canada Post is losing money due to high costs for personal protective equipment and the huge drop in the amount of traditional letter mail. But there is a silver lining.
Parcels is and delivering things to home has been just a huge North Star, because that's where we need to be.
Canada Post says COVID-19 has acted like a time machine. Its parcel projections leapfrog 3 years into the future, with a 35% jump in revenue in the second quarter alone. But it wasn't ready for it.
We need to have the capacity to deliver all of that, to process everything, because we've been up, scratching our head on the ceiling in terms of the amount of capacity, just because things have grown so rapidly.
It just won't be that easy for Canada Post to pivot.
This business professor says when Canada Post does adapt, it doesn't mean it will be profitable.
Canada Post does have a high cost structure vis-a-vis its competitors. So in addition to its labor costs, there is quite a lot of investment that has made in the past few years related to technology, being able to manage parcels, customer service, as well as the time necessary in order to then deliver these parcels.
And it's up against growing competition from giants like Amazon to smaller delivery services, even bike couriers with much thinner margins. Canada Post says it will deliver soon on its plan to shift focus. It will be investing in more parcel storage and processing capacity in the new year. Ashley Burke, CBC News, Ottawa.
Well, living through this year has been tough on all of us. Next on The National, the impact on children.
I've learned a lot of things. Patience, time management, self-control. To be thankful. During Corona, I've changed a lot.
Some pandemic wisdom from kids. Next.
For the latest coronavirus pandemic updates, breaking news, and top stories, download the CBC News app now.
I'm Jamie Poisson. Join me for CBC's daily news podcast, Front Burner. Every weekday, Front Burner takes you deep into the stories shaping Canada and the world. Subscribe wherever you get your podcasts.
Welcome back. Isolation and fear have disrupted many lives this year, but for families with children who are critically ill, the challenges are especially glaring. The places that are usually safe havens have had to drastically alter how they operate. Hilary Johnstone has that story.
The anxiety and uncertainty many Canadians experience this year is nothing new to Gregory Cole. His 8-year-old son Jesse is fighting a rare type of cancer. In a few days, the Coles will spend their second Christmas at Ottawa's Ronald McDonald House near the Children's Hospital.
He really wants to be at home. He misses his grandparents. He misses being at home, playing on his treehouse, and having all the fun stuff that he used to have.
Ronald McDonald houses give families with sick kids a place to live so they don't have to commute to hospitals. When the pandemic hit, the charity was forced to make changes to its communal home setting.
The kids that stay with us are already very sick. I mean, to think that they're spending months at CHEO during a global pandemic, they've got to be really ill. And we just want to keep them as safe and support their parents as best we can.
The 16 Ronald McDonald houses across Canada cut capacity. Extended family members can't come visit, and at some locations, neither can siblings. It's also asking families to limit how often they go home.
It's been a lot harder on families who are already having such a hard time. They're already far from home, far from their families, and now they have to stay far from each other. So
Gregory Cole says he's hopeful the communal feeling here will eventually return.
I miss coming down and seeing all the kids at nighttime sitting on the carpet or sitting in the chairs reading a book or playing a game in the playroom. And the interaction with all the other parents, I miss that.
Next month will mark a full year since the Coles stepped foot in their house. In a year when many Canadians feel like they've spent too much time at home, the Coles can't wait to get back home with their son. Hilary Johnstone, CBC News, Ottawa.
Well, children don't need to be battling critical illnesses to feel the weight of COVID-19 on their lives. The National spoke to kids who are forming deep and vivid memories of this time. And like many of us, they will remember 2020 as a year of boredom and fear, but also of family and love.
Hello, my name is Sidan Kanti. I'm 10 years old and I'm in grade 5.
Hi, my name is Leah Waldman. I'm in grade 7 and I'm 12 years old.
My name is Sean Moore. I'm 10 years old and I'm in the 5th grade.
I'm Rita Kanwai. I am 11 years old and I am in grade 6. To me, COVID is a huge killer and it's just an awful thing.
COVID is very stressful and very sad.
I love to social gather. I love to travel, but we can't do that in COVID.
We cannot go out anywhere and we cannot have like birthday parties. I've learned a lot of things. Patience, time management,
self-control. To be thankful. During Corona, I've changed a lot. I've learned that online school is not for me because some teachers, I can't understand what they're trying to tell me to do.
I want to go to normal school, but I'm just scared about dying. I get nightmares in the nighttime.
I was kind of happy and enjoying that we have online learning, but I just work, and I had too much screen time. That was really hard for me.
Online school is very tricky, I would say, because sometimes the teacher's not there and it doesn't work.
It's been harder for me to socialize. The first week of online school, I was like, can this be over? Can I hang out with my friends now?
The thing I miss the most about is that we can't eat out with our cousins, family. I've missed of going to play dates to my friends.
My bat mitzvah really impacted me a lot, probably the most during COVID, because I was very excited to go to Israel, and I'd be reading from the Torah where my ancestors stood, and then it went from that down to standing in my living room reading from a tiny Torah on Zoom.
I would usually go to a nice amusement park, and maybe I would like have a celebration there since it was my 11th birthday, but I couldn't do that. The hardest part for me has been baseball because we can't do our practices, and right now we're doing virtual online training, and that's very boring. In the summer, I was gonna go visit my grandparents in Pakistan. I already had my things packed and everything, but then my parents told me that the flight got canceled because of COVID. My grandma and my grandpa died in India. When we were going to India, we had to suffer in the plane, like wearing a mask at all times, and we had to get tested. It was a nightmare. My grandparents lived with me, so I tried to protect them by not going to school.
My biggest fear around COVID is my grandmother getting COVID because she has a lung disease, which makes her extra high risk.
My biggest fear about COVID is it's never gonna end. I fear that my grandparents or my aunts or uncles are gonna get sick. I just don't want to lose them. I've kept busy with COVID probably by watching a lot of movies, and sometimes we play soccer in the backyard. What I like the most of basketball is when I'm like shooting the ball and dribbling the ball, because I just feel comfortable like doing that all the time. I started to do artwork, felt creations. Whenever I do artwork, I feel calm.
The holidays this year are gonna be very different. My friends and I might have like a little celebration Zoom, but for now, me and my family are gonna like eat just by ourselves.
Less presents under the tree because they can't go outside and buy presents. I can't even take a picture with Santa because the shops are closed. I'm so sad that we don't get to do these things anymore. We can't go out and maybe spend some time with our cousins, but this could be a great time to spend time with our family the most.
That's good advice. When we come back, something we hope will make all of you smile: community kindness.
It's just bring me happiness, and giving back to the community will always make me happy and proud.
How this Syrian refugee is giving back to a province that welcomed him in. Our moment is next.
For the latest coronavirus pandemic updates, breaking news, and top stories, download the CBC News app now.
Abdul Jalab is a Syrian refugee who came to Canada just in January. It did not take long for Nova Scotia to feel like home and for the people there to feel like his family. When the pandemic hit just a few weeks after he arrived, Abdul wanted to give back to the community that welcomed him. It is our moment.
Since the pandemic happened, I was like feeling really sad, and I do not want it to be just a person who feels sad about his own community, because I belong here now. And I wanted to reach out and start to give back for this lovely community. I put a post on Facebook that I am willing to help people. So I afforded my time and my car and help. They have difficulty to get grocery or food or anything.
He said that he would be willing to help me in any way he could. I'm needing help in many ways. I'm 75 now. He's just very kind, very considerate, very thoughtful.
I need a family. I've been away from my family, and I feel everybody here is my family, so I treat them like my family. Giving back to the community will always make me happy and proud.
I think he's making all of Canada proud tonight, Abdul. It's great what you're doing and good advice for all of us to follow too. That is the National for this Wednesday, December 23rd. I'm Neil Kirksal. Have a great night.